The Ministry of Health has confirmed that the COVID-19 variant that was first detected in India has now landed in Kenya. According to the Ministry of Health, the variant was found in several travelers headed to Kisumu. Anita Nkonge has those details.
It's 1 week since the ban on passenger flights from India into Kenya. Despite this measure, the COVID-19 variant first detected in India has now been confirmed in Kenya after an antigen test conducted from 3 planes arriving from India.
Having done those tests, we found around 18 or so that turned out to be positive with the antigen test.
In a sample of Indian travelers who are doing some work in western part of Kisumu, we have gone ahead together with the Kisumu County health team to do contact tracing and essentially ring fence that area, especially for local transmission.
The sample from the travelers has been taken to the Kilifi Wellcome Trust for further confirmation through PCR testing. However, according to the Ministry of Health, these positive cases of variants shouldn't come as a surprise anymore.
Because of global connectivity, it is just a question of time. You cannot be able to put barriers to prevent a virus from accessing your territory.
The Ministry of Health says they have heightened security at all borders as they continue to stay alert over the various variants present.
The third wave has also been driven by these variants, especially the UK variant. We did sequencing from Kilifi of a total of 1,277 samples from March last year to 8th of April this year. And we got 31% variants of interest, and of these 31%, 71% are actually the UK variant, and about 24% are the South African variant.
The clock continues to tick as Kenyans and their government wait to see whether the second consignment of COVID-19 vaccines will be cleared in time to arrive by the end of May.
We have commitment from COVAX facility and Serum Institute of India, hoping that the situation in India will improve. And it is because of this global supply chain and manufacturing constraints that we issued an advisory that instead of getting your second dose after 2 months, you will get it after 12 weeks. And that is scientifically proper because it is supported even by the WHO guidelines.
We are continuously in engagement with other manufacturers of vaccines and exploring how we can be able to access some of these other vaccines as well.
As Kenya continues to fight the COVID-19 pandemic on various fronts, the Council of Governors welcomed President Uhuru Kenyatta's decision to lift the lockdown, but in the same breath, urged citizens to follow the COVID-19 health guidelines.
Some places of worship and matatu sectors continue to disregard the COVID-19 guidelines. In this regard, the county government, through the joint intergovernmental emergency response committees, will strictly enforce the rules of wearing masks, social distance, and washing of hands. All businesses are herewith directed not to provide any service to anyone who is not wearing a mask.
Anita Nkonge, NTV.